AI system can be entirely black box. This is entirely a human behavior problem. I think Hong Kong is in a very critical juncture.
What's your outlook on AI replacing doctors?
I think we need to distinguish one very important thing. AI is not replacing people. AI is replacing.
Welcome to my podcast. And hello, my name is Kelvin. I'm a first-year medical student at the University of Hong Kong. Today, my guest is Dr. Joshua Ho Wing Kei, and Dr. Ho is an associate professor in the School of Biomedical Sciences at the University of Hong Kong. He completed his BSc and PhD in bioinformatics from the University of Sydney and undertook postdoctoral training at Harvard Medical School. Prior to joining HKU, Dr. Ho was the head of bioinformatics and system medicine laboratory at the Victor Chang Cardiac Research Institute in Sydney, Australia. His research focuses on developing and applying cutting-edge computational methods for single-cell RNA sequence analysis, metagenomics, and digital health. Dr. Ho is also the academic lead of the bioinformatics core of the Center of Paranomic Sciences at HKU. His teaching involved incorporation of bioinformatics and precision medicine in our curriculum. As a medical student, I thoroughly enjoy the material as it trains me as an innovative and forward-thinking scientist and future medical professional. Before we begin, I'd like to emphasize that this podcast is separate from my student roles at the University of Hong Kong. It is also separate from Dr. Joshua Ho's teaching role at the University of Hong Kong. It is, however, part of my desire and effort to bring zero cost to consumer information about science and science-related tools to the general public. And with that all said, let's get to the podcast. First of all, I really appreciate you agreeing to do this interview with me. The overall theme of this interview is, can AI replace doctors? So I guess let's start with an introduction on Dr. Ho yourself. How would you, for those who might not know about you, can you tell me a little bit about yourself?
Okay, sure. So my name is Dr. Joshua Ho. I'm an associate professor at the University of Hong Kong in the Faculty of Medicine. So I teach bioinformatics. That means I teach students how to use AI, use big data, use digital health technology to solve real-world problems in medicine and in healthcare. So I've been teaching here in the last 4 years. And in fact, we have been incorporating AI and big data material into our medical curriculum. And since last year, we have been starting a Bachelor of Science program in bioinformatics. So that's something that we are doing. So in teaching data science and AI techniques to students, and also in my research work, we also use this type of computational methods to solve a variety of medical problems.
Okay. I guess the first logical question to ask you is, how would you define AI in medicine?
So artificial intelligence is really about how can we use machines, in this case computer, to simulate some kind of human-like behavior. So in a very classical sense, and this is actually an age-old problem, when people dream up the first computing machines, which is what we now call computer, people already think about the problem of, can a machine actually think, right? Can a machine be intelligent? So in fact, AI is as old as computers, right? This is a very old problem. But of course, in a very early years of computers doesn't look very clever, right? It doesn't look very intelligent. But nowadays, the main difference is that computing power has improved dramatically. Computers can actually do a lot of things that we human would describe as intelligent, as very clever, because there are a lot of things that it can do fairly quickly and produce responses that are quite sophisticated to a point that it is very difficult to distinguish whether that come from a human or come from a computer or a machine, right? And that's basically why we say machines nowadays are, have almost human-like intelligence.
I think that's kind of ring a bell on one of the concepts called the Turing test, right?
Yes.
It's like if you couldn't tell the difference between a machine and a human, then the AI has passed the Turing test.
Yes, that's right.
I think that goes back to, I guess, Alan Turing, the founding father of computing processing. But how would you say specifically the use case of AI in medicine?
So let me give you several examples that are actually real-life use of AI. For example, AI is actually very good at taking in images, particularly like chest X-ray images. So these are just large images. I think most people can visualize what a chest X-ray would look like, and doctors prescribe chest X-ray to look for various features in the thoracic cavity. For example, looking at signs of pneumonia or signs of other kind of infection and other issues. So, for example, in fact, just before I come here, I was teaching a class how to build an AI system to classify whether a chest X-ray have signs of pneumonia versus none. Normally, this would be a task reserved for a specialist radiologist. Right? A radiologist spend years learning human anatomy, learning physiology, learning all the diseases, and learning how different radiological features correspond to different human diseases. Now what we can do is to collect lots of chest X-ray images, lots of the annotation of these images. That means which image contains pneumonia, which one do not, what disease do they have, and all those information, and put it into a machine learning system. And this is what we now call an AI system, an artificial intelligence system, such that that system, after training, it will kind of have the ability to perform classification as good as a human radiologist, right? And that's one, in fact, pretty realistic application of AI in medicine, so reading chest X-ray. And for that matter, reading, doing pathology, like looking at histology images under the microscope. These are all images. People can already do that. Another area that is pretty useful nowadays is to couple AI with digital devices, like wearable devices like smartwatches, like mobile phones. Even in the normal mobile phones, there are so many different sensors like cameras, the microphones, GPS, some kind of activity tracking systems. And we can use these combination of sensors intelligently to track the health of the person who carries this device. And this is very important because it takes into the concept of continuous care, continuous monitoring of the well-being of a person. This is something that's really not easy to do in a traditional patient-doctor consultation session. A doctor only do measurement when they're inside a clinical environment with a doctor, with a nurse, with a laboratory technician, right? But in a continuous digital health setting, once you carry those devices or make your device compatible with collecting those data, like a mobile phone, you can now actually use this to collect your own health data and digitalize and record it and do long-term monitoring. And that's really very powerful.
When you talk about the radiologist example, it almost reminds me of this very audacious statement from a lot of AI engineers that radiologists is soon going to be replaced. How would you kind of see it? Do you think it is feasible, or you think what's like the outlook of it?
I think we need to distinguish one very important thing. AI is not replacing people. AI is replacing tasks. And I think this is a key distinction. The analogy that I always give to medical students is that autopilot flies plane, most commercial plane, right? If you hop on a commercial plane, go elsewhere, an autopilot system, which is a computer system, flies the plane most of the journey, okay? But you still see pilots there. You still have the pilot, the co-pilot, they sit at the cockpit, they're there all the time, but they do not actively fly the plane most of the time. Okay. They're only involved in some of the most critical component, right? Most of the critical tasks, including taking off and landing and maybe dealing with some troubleshooting and emergency situations, right? But without those situations, the plane, is flown by a computer. And we accept that, and we're pretty okay with that. And to be fair, what that means is that in the training or in pilot training, in aviation training, they need to learn how to work with this type of computer systems. So I think the way to think about it is that future radiologists, or indeed future doctors in general, need to learn to work with this type of AI or digital health systems, because they need to work with this kind of evolving technology such that we can maintain the same level of care, or in fact better level of care, by moving some of the more repetitive tasks to an AI automated system so that it can do that kind of job, and you reserve the human doctors and use so that they can spend their human intelligence on some of the more meaningful aspects of being a doctor, like, for example, communication, right? Showing communication that actually are empathetical, right? Show good empathy, and to think very carefully about how to optimize their care beyond standard care, right? I think that's what the future should look like.
So you mentioned a lot on the kind of distinguishable factor in the human is the ability to express humanistic expressions, right? How would you break it down? Do you think can AI sort of simulate that too? I've seen like a lot of robots coming, like Tesla AI, the very famous one is the Sophia ones. They all are starting to develop sort of complex algorithms that sort of simulate human factors, for what you just mentioned.
Yes.
Do you think in one day that empathetic, that communication element could ultimately be achieved in a robot or an AI too?
Yes, I'm very certain this is possible. So again, you see, I'm not saying that machines cannot behave as if it has empathy. In fact, it does,
I think
right?
so too.
If you look at ChatGPT right now, it can already behave as if it is an empathetic agent, right? If you take away the interface and maybe put a speech synthesizer on top of it, it can really sound like and behave like an empathetic agent already. So it's not really about that, but I think it's really having a human at the moment at least, right? And in my mind, in a foreseeable future, is still a lot more adaptable to a wide range of situations. One of the core principle, in fact, maybe perhaps even limitation of AI as we using today's technology, is that it is dependent on the training data. It must have good quality training data. To be fair, to train ChatGPT, for example, or other similar very cool AI system that you see right now, require a huge amount of background work in creating, annotating, processing, massaging, cleaning the data for training before it becomes useful. Right, there are years of training with that. In a way, human, if you see baby grow up, through kids and have tried to teach young children, they are kind of like kids, right? The AI system nowadays, if you get them to train them to do one task, they can probably do it really well. But as adult, now we have gone through many years of learning. One thing that is unique to human is that we have gone through a wide variety of situations. Some of them might not have anything to do with medicine or the healthcare of people in any traditional sense, but we know how to deal with them. So basically, we have much more all-rounded experience, more all-rounded training. Therefore, what we should do to make sure the next generation of medical students, for example, can exhibit this, have this ability to not necessarily superiority, but utilize the strength of being human, is to have all-rounded experience in your life, right? So, because again, to be fair, learning anatomy and learning physiology, the machine can probably do well too, right? It can probably pass the exams quite well.
Definitely seen news that ChatGPT is passing this USL.
Yes. Some of the time. Yeah. So I think it's really about the other things, right? Because there are new situations that will always emerge, right? It's new situation that's never been described before, never been seen before. But as human, if we have diverse experience, then maybe we can start to form new connection more easily. Not necessarily because machines cannot do it, but maybe this is not part of the training data that was used to train that particular system. So human is an ultimate continuous learning agent, if you think about that.
So is it fair to say that AI is really good at the things that are previously done, whereas human is more have the mental agility and flexibility to sort of synthesize new information as we learn it? Would it be fair to say
I think human at the moment, at least, again, I'm not, I cannot predict what will happen in AI in 5-10 years time, but at the moment, based on the technology that we have today, I think humans still have a slight superiority in terms of forming connection to new, unexpected, unseen situations. I think this is still reasonably fair to say, and I think this is still our strength, right? For example, when doctors see a patient, maybe they have certain signs and symptoms that suggest disease A, but there are also several things that are new, but these new things has not been described before because these are new technology, right? New DNA sequencing technology, new other kind of technology that has never been described in textbook or in literature, and therefore it's really hard to integrate them. But again, we human supposed to have all-rounded experience and education, and they should be able to form these connections. And I think we still have some superiority in doing that type of connections, and I think this is something we should be using a lot more.
So do you think instead of the term replacing, it is more like a partnership between technology and clinicians?
Absolutely.
Yeah, how does it change the role of a doctor? How would you sort of think about that?
I think being a doctor in the next 5 to 10 years, we must be able to work with this type of technology, being AI technology or any other kind of technology that come from, say, hardware systems, wearable devices. We must be able to work with them and embrace the incorporation into your routine daily practice. And I think this is very important that we are able to do that. So being versatile, flexible, but also insist on a good level of care. And I think that ultimately is very important. And therefore, I think it's about evaluation of the AI system. So being be able to decide whether I want to use this into my clinical practice, whether I want to use that data point when in my decision-making process, and whether there will be, it's about risk and benefit. Whenever there is new device, new information, new decision support system, there's always a risk and advantage kind of analysis. But to be fair, this is true for anything. Introduction of new drug, we'll have that balance. Introduction of new surgical equipment or new imaging modalities, they always have that. And therefore, this is not new, right? Evaluating the validity and clinical utility of any technology, there are standard procedures and evaluation systems to do that. It's just that AI seems very mysterious, right? But again, to be fair, the evaluation can still be done. And there are, we just need to make sure we hold them to a high standard. Don't be too, don't jump on it because it's the hype and this is the new thing. But don't be too afraid of incorporating new thing. So just take it as if this is just a new, like the new surgical equipment, right? And you use the same kind of logic in deciding whether I incorporate it or not.
You mentioned of some of the potential problems or concerns that we need to be particularly cognizant when incorporating new technologies. What are some of the, I guess, ethical concerns that you think with the rising technology of AI are things that we as scientists or medical professionals need to be specifically aware?
I think one thing that is important, in fact there are a couple, but one that comes in my mind is if the system supports decision making. So not all AI systems necessarily support decision making, but many do, because it gives you some kind of classification, right? It would tell you, okay, in this image, this part may contain a tumor, look at it, right? So this is kind of decision support. Or, okay, looking at your gene expression profile or genetic profile, you are more likely to have that particular disease than other. That's decision support, because it gives you information that would hopefully help you or guide you to make a certain diagnosis. So this is decision support.
Course of management. Those
exactly.
are the important things of concerns, we think.
That's right. So I think having a high standard for evaluation is important, like introducing new drug and so on. So evaluation is important. And one of the issues that makes it particularly difficult is about the power of explanation of AI system. AI system can be entirely black box. Just like that. So you can have a, if I am a doctor who are amazing at reading chest X-ray, I'm a radiologist. I'm a very good doctor at reading chest X-ray, and the classification accuracy is 100%. Every single chest X-ray in front of me, I can make the correct diagnosis and is 100%. But what if I tell you the way I do that is rolling die at the back end? How would you feel? But I can actually produce very high accuracy. How would you feel? So that means I'm making a decision based on something that is essentially random chance, and not based on any kind of anatomy and physiology or pathology, but the effect is good, right? What do you feel about that?
Confident.
And I think this is the thing. But again, to be fair, let's say in an objective test, I can indeed perform 100%. What would you say? Right? How do you know a real radiologist use anatomy to solve the problem?
It's good to take reference from previous data, but again, based on that, you can't predict the future. Can you?
You see, to be absolutely fair, I do not think we need explanation to make a genuinely good decision. If it indeed pass a very comprehensive, fair, unbiased test, then it is good. It is effective, and it has. I really shouldn't care about explanation.
What do you mean by that, unbiased?
If I can, let's say, okay, for a specialist radiologist, for some of the image interpretation tests, it really is giving you a lot of images, and you give your diagnosis. Let's say for that test, a AI system and a radiologist can pass the same exam, get the same mark. Would they get a fellowship?
Assuming that.
Therefore, this is what I mean by a test, right? They can pass the fellowship exam, they should get it. But the feeling is different, right? For radiologists, you can probe them further, not just the diagnosis. You can probe them. Why do you think I have pneumonia? What are the radiological features? Can you explain this to me? Then a radiologist hopefully can explain that to you, right? Can tell you, oh, because of this and that and that and that, and therefore I believe this is it, right? And the explanation should be consistent with our understanding of human anatomy and physiology and the normal natural history of what pneumonia is, right? An AI system may not be able to do that. So therefore, it's not about the accuracy alone. It's about human acceptability. And human acceptability is not the same as whether it genuinely performed well based on some objective criteria. So there's still a human element of trust. Right? And the human element of trust has to be built, and typically is built based on, having some explanation is helpful. And this is something where the current technology of deep learning falls short. It's really not easy to produce the same kind of explanation as a human can currently do.
So are you saying that there will still be an explanation, but it might not be an explanation that us humans are able to understand or socially accept?
Yes. Yes. Let's say a deep neural network say that, it gives you saying this chest X-ray image, this contains pneumonia, 100% accuracy. And in fact, it is true, right? That patient does have pneumonia. So therefore, the prediction was indeed correct. But then you ask the system to produce an explanation. And the explanation is, look at the bottom left corner of this image, and then just highlight that circle, that area. Is this good enough? Maybe not. But I would imagine a normal patient, a human patient, would ask a lot more questions than just say, my diagnosis is this or that, right? They would probably want to know a lot more, even it has nothing to do with the treatment. It may not alter the diagnosis, and it may not even alter the treatment, right? And it may not have actual real life consequence, but trust is built on the explanation.
Okay.
That's just human behavior. So it's really about, because AI, even it can perform as good as a human, remember, in a healthcare system, in addition to the doctor, there's also the patient and a patient's family, right? You're treating human, and human have certain desire of knowing, and understanding induce trust. And that's the kind of, unless human evolved to a stage where the AI system is so widespread that we do not need explanation to have trust. It might be possible, right? You see, this is entirely a human behavior problem. Has nothing to do with technology.
Wow.
So if the technology is so widespread that we can have trust in the system itself, then that might be okay.
How would you say, in the eye of the public right now, how do they sort of accept AI into healthcare? Like, would they be okay relying on machines telling them what's wrong? Like, what do you think is the public perception on that right now?
Like any other new technology in history, there will be a time where people are a little bit scared, and people will be testing waters, and then at some stage things will happen, and then people will just generally accept thing, right? Autopilot in aviation. I think let's imagine in the first few years when the actual autopilot system, and you're telling your passenger that your pilot is not flying the plane. Your entire journey in the air is not controlled by a human, is controlled by a computer system. I'm not sure whether you will be the most willing passenger, right? You'll be most excited. But to be fair, now you don't even think about it. You just go, and you're more than happy, because the trust has been developed, and the trust has been developed through time. So again, what I'm saying here is that this type of things will evolve. In a beginning, it will always be difficult. There will be one caveat though, in the digital health, because there's actually one other challenge, one ethical issues, which is data and data privacy and confidentiality. In relation to certain data collection modalities, such as wearable smartwatches, mobile phones, because, or maybe even some social media text, right? Twitter and Instagram posts, because even though it may not be identifiable in and of itself, like they have name, they may not have, even if you take away the name, the ID, the IP address, and all those more sensitive personal information, by looking at the data in totality, we still may be able to infer who you are. That means this is about re-identification of a person. So let's say I use the watch and wear it and go about my daily life with the whole point of really just taking heart rate and using that for your own self health monitoring purposes. That information by itself may not actually be personal, in a sense that it doesn't contain identifiable information, no name, no IP address, and so on. But if you also use, for example, the activity tracking system, and by using that watch for a very long period of time, you might actually start to see pattern. Let's say every day you have certain pattern, and at night you always go back to the same place. We can kind of infer that must be your home. And if we can infer your home, we infer your address, and very quickly we can know who you are. And therefore, this have a strong, may have some unintended consequences in re-identification of a person without the consent or knowledge of the person whose data are there. Okay, so some of this could be alleviated by better IT cybersecurity. Some of this could be alleviated, and some of this we just have to accept as human. Got it. Eventually, many of this data will have to be not as private as we would wish to. I mean, we just have to be okay with certain fact.
Okay, got it. How do you think, I guess in Hong Kong right now, on the development of AI, is it something that we need to maybe work a little bit harder on incorporating them, or is it still in a very, like compared to other countries in the world, how would you say the development of AI in healthcare like right now? Are we in a good stage of development, or are we still very in a juvenile stage?
I think Hong Kong is in a very critical juncture. We have a healthcare system that is very reliant on human capital. That means doctors. That's why we keep saying we need to train more doctors and nurses and healthcare workers in a system, because it's still very human heavy. A lot of the job is done by human, not by technology per se. But what I can see in the last few years is that there's a tremendous amount of goodwill and actual investment in infrastructure, in training of people to make sure we transition into the smart hospital, smart healthcare kind of system. In fact, in some of the hospitals in Hong Kong, they are now actually called smart hospitals because they actually, a lot of the data collection are already automatic and digitalized, right? Highly digitalized, somewhat automated, and also in our medical school, particularly the one in Hong Kong Yuen here, we actually have been incorporating digital health and AI and big data education into our medical curriculum, right, for a few years now, actually. So hopefully in a few years' time, we'll actually see doctors with actual proper training in this. So that, not that we want them to be an AI engineer, right? They will not be. They will still be doctors. But they will be doctors who are not afraid of incorporating them in real life. So I think there's a tremendous goodwill and a critical juncture of using that.
So instead of solving that so let's say the workload is the problem, right? Instead of getting more human capital, it's basically making each doctor and nurses or medical professionals working more efficiently.
Yes.
So that's, again, could solve the workload problem.
So I think it is about reallocation of tasks that are traditionally very rigidly assigned to a particular person. Let me give you some example. Sure. Some of the health check is basically done by doctors. I would argue, and some have already suggested, that some of this we might be able to assign to, say, nurses plus some kind of AI assistant systems, right? So if some of this can be reallocated, then it free up actual doctors to do more meaningful actual clinical duty. So if some of the cold and flu can be reassigned to, say, a well-trained nurse or some other kind of professional with some help with AI system, so that the task is a bit more automated, then maybe this could work better. So doctors save time, less time doing things that may not actually require the actual expertise.
Got it.
Right, so that they can actually use their time more meaningfully to deal with actually important cases.
Maybe. Exactly. So, as medical students right now, how would you advise us to get a good start on maybe improving digital literacy, be more technology aware? Like, what are some things that you would advise the next generation of future medical professionals to be sort of start thinking about?
I think students nowadays have a lot of opportunity. They've already been exposed to, AI. Or these are things that are in the news all the time. There are tools that you can already use. Try them. Don't be afraid of them. Just get exposed to them. Try them. Embrace them. But embrace them carefully. Just like you embrace any piece of surgical equipment, any drugs in the hospital, in a clinic, right? You have to address all of them with a good level of care, but embrace them, right? And I think this is the important thing. If possible, and if your interest lies in that area, learn some computer coding is a good idea. But not necessarily with the goal of becoming a computer programmer, right? That's not your job, right? You work with computer programmer, but to learn enough such that you're not scared of doing some very basic an analytical task, I think that would be quite useful.
So just understanding the syntax of it. Maybe.
And also being able to do some very basic data-driven analysis. So for example, if you can download the COVID-19 case count and mortality from government website, which they are in government webpage, download them and write some simple code, maybe 10 to 20 lines of code, do visualization analysis. That will already elevate your understanding of the world, right? So that you're not reliant on, just passively receive information, but can actively do analysis and investigation. This is something that when I've been talking to a lot of actual medical doctors, they are really hoping to learn themselves, like practicing doctors, right? Very senior doctors. They are telling me, Joshua, I want to go and learn R programming. I want to learn this data analysis myself so that I can do this myself, right? So I think there is certainly a demand. I don't think medical students should become a computer scientist. That's really not the point. It's really for them to learn enough so that maybe the level of understanding computer literacy is going beyond being able to do Word, Excel, and word processing, but beyond that, and be able to analyze data, manipulate data, visualize data, and if we can do that, I think we'll be in a good shape.
I think coming from a background in research, because medicine is my second degree, I think this is definitely helpful when it comes to the data and analysis bit. Because right now, even writing a lot of analysis, you don't really use Excel, you use coding into incorporating large amount of data, generating analysis, all these statistical tests. It's definitely helpful. And who knows, maybe you could use that to sort of increase your efficiency in supercharge your writing on new research and systematic reviews, and I certainly see the use case for it.
In fact, what I've been telling people is that medicine is not just human biology. That is a very old way of thinking about things, right? Obviously, you need to learn human biology, obviously, but it's way beyond that. In fact, most of the time, a doctor is what I would call a big data analyst in real life, right? Because when a patient comes in, you need to ask questions, right? To know what's wrong with them, what's their chief complaint, what are their symptoms, and then you do your examination. That means you might do auscultation using a stethoscope, you might try to work out where they have pain, you might need to get them to do certain movement to work out what's wrong with them. These are data generating exercise, right? Even though they may not be digital data, they could be actual audio data that you listen in your ear, but these are data nonetheless. And a human doctor, in fact, the most important task is to be a big data analyst, analyzing all this data in their mind, perhaps, and then to come up with an action plan that includes a diagnosis, a treatment plan, prescription, that will hopefully improve the health of your patient. That's what medicine, clinical medicine, is supposed to be. And therefore, what we're saying here is that some of this data nowadays are no longer just analog data, like stethoscope listening to the ear, and after this, no one will be able to know what the sound is. This sound could be digital now, right? Images are now digital. When you take X-ray, they are digital images. Sound can be digital. There are many other things that can be digitalized, and that's why we need all this bioinformatics tool, the digital health tool, to integrate this data. So it's really an extension of a doctor's clinical decision making into a computer program, a piece of software, an app, or a piece of hardware. It's really about that. And how do you use this and your brain collectively to come up with the diagnosis and treatment plan? That's really the heart of medicine.
It reminds me of one of the companies that I was looking at the other day when I was buying stethoscopes. It's called Echo. It's basically a recording device that could be attached to your Littmann stethoscope. And then whenever you hear the heart sound, it picks up that recording, and in the app it would cross match with the sort of huge amount of database they have already collected and give you a preliminary diagnosis just based on just a simple piece of device, and I just find that pretty cool. But okay, to the final question, I guess. Do you feel, what's your outlook on AI replacing doctors?
I think the way to say that is that doctors who knows how to use AI system well will replace doctors who don't.
Okay.
I think that maybe that's a better way to look at it. Again, we always need people, in this case doctor, who have the right medical knowledge. We will always need those people. Just like even we have autopilot, we still have pilot, actual human pilot, and they're always there. So I don't think it's replacing them. But again, nowadays you cannot just have an old style pilot who do not use autopilot. They will not be flying a plane.
Got it.
Right? You see, I think it's really that concept. And again, the pace of this picking up will differ between different medical specialty. Right, some like radiology and pathology might be a little bit ahead because these are things that are a bit more digital to begin with. Sure. But there are also some discipline that they're making their way into their discipline. Radiology, of course, but clinical oncology, like looking at the use of genetic data into treatment planning, for example, in oncology. That's one big area that a lot of people are doing. And also using digital devices in long-term care, like in medicine or in family medicine or even in emergency medicine, right? Using those using the data collected by those sensors and using that to and enhance their diagnosis. I think this will definitely be the future. So I think it's very exciting. I think we all should do it.
I'm optimistic too. I'm very welcoming on this new technology, and definitely goes back to what you said. I think the more important bit is being able to adapt and learn that new technology, and not be someone who's just being comfortable and conservative.
Yes.
All right. Thank you for sharing. Really appreciate that. Anything you want to add, or?
So essentially, you're saying doctors that can harmonize with those computers, they can thrive the most. But then how do we make sure that our doctors, our future doctors, are able to be trained in their communication skills and their way of interacting with the patients so that they can deliver the care in healthcare?
Yes. I think this is absolutely the key. We should be making sure it's about refocusing. So when we are introducing the AI and big data topic into our Hong Kong U medical curriculum, we've been very careful because we are more than aware that by introducing new things, students either get busier or something has to go, right? Exactly. We cannot just infinitely add things to the same curriculum because students can only study that much, right? So I think we're always being very careful about balance. Of course, medical students, they have to have all the basic medical science and clinical skills. They all need that. So it's really balancing what are the stuff that could be reduced and what are the things that can be merged. In fact, in one of our current strategy is to incorporate this kind of big data and AI things, not only as a standalone teaching session, but also be incorporating them into other disciplines. For example, in oncology, in radiology, maybe in pathology, in medicine, in family medicine. So I think it's always going to be all that, such that when you get trained in that discipline, in say family medicine, about let's say in terms of doing long-term care planning for chronic disease management, you will be thinking about how to use those additional digital data as part of your training, incorporating and extending what's currently taught. And I think that will be the goal. So that is not, I teach you AI, and then tomorrow you go to learn your normal clinical note-taking skills. Maybe in the future, note-taking skills should incorporate digital data into it as part of the training. That would be my ideal goal. So that in your communication skills, in your analysis skills, the two will no longer be distinguishable. Again, like in a pilot in a commercial flight, you use data by using all the sensors in your cockpit, but also you look outside too, right? You still have a human, you have to have an eye, right? You still look outside, and you incorporate all this information to make decision. And I think that's the critical part.
Yeah, once again, thank you for your sharing. Really appreciate
Thank you very much.
that. Thank you for joining me for today's discussion with Dr. Joshua Ho about AI in medicine. If you're learning from and are enjoying this podcast, please subscribe to my YouTube channel. That's a terrific zero-cost way to support us. In addition, please comment if you have any questions that you would like us to answer or clarify. I do read all the comments. And finally, with that all said, thank you for watching, and then I'll see you guys in the next video. Bye-bye.